Hello everyone, my name is Bakheet Aljedaani and I am from CREST, the Center for Research on Engineering Software Technologies Research Group at the University of Adelaide, Australia. Today I will be presenting our work, an empirical study on developing secure mobile health apps, the developer's perspective. This work is a part of my PhD research and it is co-authored by Aakash Ahmad, Mansooreh Zahedi, and Muhammad Ali Babar. Here's the outline of my presentation. I will first introduce the topic, followed by the research objectives. Then I will walk you through the adopted research methods and highlight the study findings. After that, I will present the threats to validity. And finally, I will conclude the paper and point out some ideas for extending this work. So currently, millions of mobile apps which are available to use and download to improve our daily lives activities. Among them, mobile health or mHealth for short. mHealth apps are revolutionizing delivering healthcare. In fact, mHealth apps became a promising technology that provide for us low-cost, efficient, and digitized health services. Studies showed that mHealth apps have been proven to improve the quality of services in many health, health scenarios. For example, dermatologic care, managing chronic diseases, clinical practices, and mental well-being. As we can see here from the figure on the right, mHealth apps can be categorized as general health apps and fitness monitoring apps. Not only mHealth apps, but all mobile apps collect, process, store, and transmit user and device data in and out of a device over various networks. Any compromising on the confidentiality, integrity, and availability of data would lead to compromising the devices, which lead to compromised device information such as location activity tracing, and hence leading to a financial loss. Therefore, the security of mHealth apps should be ensured during during the early stages of developing mHealth apps. And the developers of mHealth apps has a big role to ensure the security. So before presenting the research objectives, we conducted a systematic literature review that has been already submitted to a journal to understand what researchers have been done, as well as the potential research gaps. Thus, we were able to identify the following research questions. Research question 1, what challenges do developers face while developing secure mHealth apps? Research question 2, what practices are used to incorporate security measures in mHealth apps? And finally, research question 3, what motivates developers to engineer and develop secure mHealth apps? For research question 1 and 3, we collected qualitative and quantitative data based on which came from the literature review And for the second research question, we only collected qualitative data because we did not want to limit our respondent to specific security practices. So here's the full picture of our methodology. It has 4 phases, and I will be going over them briefly. Phase 1. The first phase, we designed the study protocol and questionnaire. We developed a survey which has 15 questions. The first 3 questions are screening questions to ensure that we only involve mHealth apps developers. We asked the respondent to provide the name of the app, explain how the app works, and a link for that app. To improve the survey contents, we tested it with the first 24 respondents. For phase 2, which is inviting and engaging participants, we followed 4 methods to recruit developers. First, we sent email invitation to our contact. We received 17 responses. Second method, we send invitation to GitHub and Google Play Store developers, and we received 29 responses. We posted our survey link on social media and received 37 responses. And finally, snowballing and we received 14 responses. Total number of sent email was over 1,300, and eventually we ended up with 97 responses. For the third phase, which is demographic analysis of survey respondent, we ensured that we get representative data by having respondents from different geographic location, development experience, team size, years of experience, and using different development platform. And for the fourth phase and last phase, synthesizing and analyzing survey data, we used descriptive statistic to present the result of the close-ended questions, such as Likert questions. We use thematic analysis to present open-ended questions. In particular, we used in vivo software to organize and review our generated codes. Now I will be moving on to highlight our results. For research question 1, we provided a Likert scale question to rate the respondent agreement on 8 critical security challenges which have been identified based on the SLR. This question is followed by an open-ended question to mention any other challenges by the respondent. Thus, we identified 10 critical security challenges. The top 3, which have received the highest agreement, are little or no budget for employing security, received 85% agreement, followed by insufficient security knowledge, received 80% agreement, and lack of security testing for the mHealth apps, which received 75% agreement. Our respondents also indicated that they have difficulties in dealing with legal obligations, policies, and procedures, and they found it is difficult to maintain mHealth app data. For research question two, we provided one open-ended question to the respondent because we did not want to limit them to a few practices. For analyzing the respondent data, we used Microsoft software development process, which has 5 phases. We identified the security practices based on their appearance on the software development lifecycle. For example, for requirement engineering, our respondent indicated that they prioritize security requirements. They use secure code analysis for software implementation. They used attack simulation for the verification, software verification, and they use app security review for the software development deployment, and they use security guidelines for software designs. Interestingly, a few of the respondents indicated that they have not been using any security approach. For the third research question, we followed the same approach that we used in research question one. We provided some motivational factors which we identified from the literature, followed by an open-ended questions to allow them to share other motivations. So we identified 10 security motivational factors. The top 3 that has received the highest agreements are insecure mHealth apps would have a bad consequences, 85% agreement. Secure development to maintain the vision and reputation of organization, 81% agreement. And finally, secure app development for career path and promotion received 71% agreement. Our respondents also indicated that they were motivated by the practices of their organization to ensure the security, and they were motivated to reduce the cost of maintaining the app later on. To conclude our study, we investigated the developers of mHealth apps' views on the security challenges, security practices, and the motivational factors to ensure the security of mHealth apps. Our results can be helpful for researcher and practitioner with evidence-based knowledge to develop secure mHealth apps. Now I will explain the potential threats to our study. Our study might get affected by the sample size, which can affect the generalization. We also believe that we have not achieved data triangulation, and the data were collected from one source, which is survey. We also believe that our data can be affected by the multiple responses by the same respondent because we provided $10 gift card for those who respond or provided us valid response. For future work, we believe that this study can be further extended with the users to understand the security challenges from their views. We also believe that this study can be further investigate the impact of the identified security practices. And this study can be further extended by focusing on the motivational factors, such as the role of security leaders and how they affect the secure mHealth apps development. We acknowledge the support of the Cybersecurity Cooperative Research Center, and we acknowledge all the CREST team members for their valuable inputs. And we thank all the participants who involved in this study. Thank you very much. Questions and answers.